You learn in health assessment that in all aspects of healthcare, it's vitally important that you document what you do. If you don't, then your patients won't have the benefit of that data from before. There's an old adage in healthcare: if you didn't document it, you didn't do it, because it's that vitally important. Clarity and precision of documentation is really important. And to that end, I'm going to give you some language that you might not have. Some terms, some of them you'll be familiar with. Other terms on this list will probably be a little bit new, or maybe I'll be using these terms in a little bit of a different way than that you're used to. But in nursing documentation, it's really important that we specify exact locations of our findings, whether it's a lesion or something that we auscultate or something that we palpate, so that the next person who is examining that patient knows what's happened in the meantime and what the thing looked like or sounded like and exactly where when you examine that patient. Some of the confusion in documentation can come up when we're talking about location on a patient, because words like up and down and below don't always stay the same because human beings move. So we need to have a standard nomenclature for where on the anatomy a finding is, so that the next person reading the note is going to know exactly, no matter what position the patient is in that shift, they're going to know where to find this finding. There's something called standard anatomical position, and that assumes that your patient is standing up with feet together or sort of hip width apart, arms down, palms forward. And that is a useful reference point for some of these terms. The word superior means towards the head. Inferior means towards the feet. Cranial also means towards the head or of the head. The word anterior means towards the front of the body. Posterior means towards the back of the body. Ventral is almost like a synonym for anterior. Ventral tends to mean towards the front, but also about the belly. Ventral tends to imply the belly area. Dorsal means towards the back, so it's almost analogous to the word posterior. Except that dorsal can also be used for the back of smaller things, like the back of the hand or the top of the foot, which is confusing because in that case it's not the back, it's the top. Imagine if a human were on all fours like a dog, that the back of the hand is correlated to the top of the foot. So the part where the hair grows, all right, is the dorsum of the hand and the dorsum of the foot. And the dorsum of the body is the back. Superficial and deep tend to be relative words. So something is deep within a joint or within a bone, as opposed to superficial near the surface, near the skin. Distal and proximal are only ever used really on limbs, so on extremities. Upper extremities are from shoulder, arms, elbow, wrist, hands, fingers. Lower extremities are hips, legs, knees, ankles, feet, toes. We refer to left upper extremity, right upper extremity, left lower extremity, right lower extremity with these initials. Sometimes you see them in the reverse order. So upper right extremity or right upper extremity, I don't know if that it matters. You'll know what it means in context. Keep in mind that right and left refer to the patient's right and left, even though your patient is likely to be facing you. And the words distal and proximal are only ever used on extremities. They're not really used on the head and the trunk, because what they mean is, relative to each other, which one is towards the trunk. Proximal means towards the trunk, and distal means away from the trunk. So for instance, my elbow is distal to my shoulder. So these words distal and proximal are only ever used in comparison to another thing, all right? You wouldn't say that the lesion is proximal. It has to be proximal to something. If it's proximal to the wrist, that means it's closer to the trunk than the wrist is. So the ankle is distal to the knee. The ankle is proximal to the toe. The shoulder is proximal to the elbow. The elbow is distal to the shoulder. The thumb is distal to the wrist. So if I say that a lesion is near the shoulder, near isn't very specific. I need to be more precise. So I could say on the anterior aspect of the shoulder, or on the anterior aspect of the upper arm, a certain number of centimeters distal to the shoulder. So distal and proximal are relative and compare 2 points on an extremity. Medial means towards the center plane of the body. Lateral means towards the sides of the body. Lateral, like lados in Spanish. These are a few words that refer to areas of the body. Cephalic is of around the head, thoracic of and around the chest, abdominal. Within abdominal, you have celiac, which is around the umbilical area, and pelvic refers to the pelvic girdle and parts of the body inside the pelvis. So some other areas of the body, cervical means related to the neck. Thoracic area can be from the dorsal aspect as well. The lumbar portion of the back correlates with the area of the lumbar spine. The sacral area is around the sacrum, and the gluteal area near the gluteus maximi. Now we refer to the midsternal line as this line that goes right down the center of us, that goes through the sternum. And if you imagine the clavicles here, midway through the clavicle is a midclavicular line on either side, left and right. And the anterior axillary line is at the anterior of the axilla. The axilla is the armpit, And anterior axillary line means towards the front, anterior. And we have the posterior axillary line and the mid-axillary line. So those are longitudinal lines. Some other words you are probably familiar with. The palmar surface means the palm of the hand. Plantar surface of the foot is the bottom or the sole of the foot, like you're planting your foot down. And don't forget the top of the foot is the dorsal aspect of the foot. Abduction and adduction refer to motions of the extremities. Abduction is sometimes called abduction because adduction and abduction, especially in verbal communication, can be misunderstood. So sometimes people say it verbally, adduction, abduction, to be real sure that we're communicating well. Abduction means moving away from the body, so the arms or the legs moving away from the body. Adduction, adduction means moving towards the body. Pronation and supination are motions of the elbow joint. So if you have the forearm and you're moving it up and down like that, actually the motion is coming from the joint of the elbow. So think about supination, meaning your palm up. Pronation means the palm down. The motion or the position. Generations of nursing students before have learned to remember this because you can hold a bit of soup in your hand if it's upright like this. So that's supinated or pronated. Now, supinated and pronated can also refer to the body itself. If you're lying down on your back, that's supine, face up. And if you're lying face down and your back is up, you're lying prone. So kind of like the body is a hand, all right, prone and supine. Flexion means when you have two bones that articulate in a joint, bringing those two bones closer together is flexing. Making those two bones farther apart is extending. Some joints hyperextend, like the hip, that's flexed, extended, and hyperextended. Look at this joint here. Right now it's extended, flexed, extended, hyperextended. So some joints are able to hyperextend. Your spine can hyperextend. Your wrist can hyperextend. Your knee can't hyperextend. It can only flex and extend. Our neck in this position is extended. That is hyperextended. This is flexed. All right? That's bending and that's twisting. Our shoulders and our hips are ball joints. That means that they can also rotate. External rotation means rotating the shoulder out or the hip. Internal rotation is rotating it in, all right? External rotation, internal rotation. Same with the hip. Internal rotation, external rotation. Now you've got a lot of anatomical terms for directions, motions of the body, and areas of the body that are clear and specific. Knowing how to read, understand, use, document using these terms is going to make your practice much easier, much clearer, more likely that you'll communicate better with your colleagues.